very important for us to understand respiratory failure because of the COVID-19 condition that's affecting the world at the moment. And one of the sinister complications is respiratory failure. So the thing is, I will go deeper into respiratory failure and explain the different types, like there's type 1 and type 2. And in both types, the PaO2 is less than 60 millimeters of mercury or 8 kilopascals, or the saturation is less than 90%. So with type 1, the main problem is oxygenation. So we're looking at problems with flooding of the alveoli, which could either be with water, as in near drowning, or it could be due to gastric contents with aspiration. It could be due to pneumonia, which is more an exudative picture, or it could be due to pulmonary edema, which could either be due to heart failure or renal failure. And you're also looking at VQ mismatching. We're looking at an increase in the AA gradient meaning alveolar to arterial partial pressure of oxygen gradient, and that's due to interstitial lung disease. And then when you talk about type 2 respiratory failure, we're looking at a problem where the PaCO2 is raised. And when that occurs, it means that the ventilation is being compromised. And when the ventilation is being compromised, it can either be compromised because of obstruction, or it can be compromised due to problems with the respiratory pump or the apparatus involved with respiration. So we're looking at sedatives causing respiratory depression in the brain, along with coma, decreased level of consciousness, coming down the spinal cord, any cause that causes the spinal cord to be impaired, like Guillain-Barré syndrome, or even injuries. Looking at the spinal nerves, we're looking at the neuromuscular junction, looking at neuromuscular blockers, and we're also looking at myasthenia gravis. And then the muscle itself, the muscle may be weak itself, and we're looking at the myopathies. So there we have it. That's respiratory failure. It's something which we really need to know, and it's important for us to know it because if we understand what the cause is, we can institute appropriate management. Thanks a lot.